Have you ever woken up in the middle of the night, violently sick, after eating at a questionable restaurant earlier? Or maybe you've slowly felt worse after hearing about a stomach bug going around your office or your child's school. Today on Urgent Care Uncovered, I'm bringing you inside my urgent care clinic to break down how doctors tell the difference between food poisoning and the stomach flu. We'll talk about symptoms, what to watch for, some dangerous myths, and when you really need to seek help. Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel, and to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it. Now, let me tell you a story. A few weeks ago, I saw a patient. Call her Jessica. Jessica decided to treat herself to a spicy chicken sandwich from a certain fast food chain that's closed on Sundays. You know the one. A few hours later, she woke up in the middle of the night, nauseous, cramping, and vomiting over and over. So she came into clinic the next morning, and based on how quickly her symptoms had started, I suspected classic food poisoning. Now, stories like Jessica's help us break this down. Let's get into the details. So, what's the difference? In urgent care, one of the first things I ask is, when did the symptoms start? Food poisoning usually happens after eating contaminated food. Bacteria like Salmonella, E. coli, or Staph aureus. Symptoms tend to hit fast, just like in Jessica's case, within just a few hours. Now, the stomach flu, what we call viral gastroenteritis, is different. It's caused by viruses like norovirus or rotavirus, and it spreads from person to person or through contaminated surfaces. And symptoms usually begin 1 to 2 or 3 days after exposure. Now, let's talk symptoms, because this is where the confusion really starts. Here's what I look for in clinic. Firstly, timing. If it hits you fast and violently within hours, it's likely food poisoning. If it builds slowly over a day or two, it's more likely stomach flu. Vomiting. If you throw up a few hours after eating, food poisoning is a strong suspect. But if it spreads through family or coworkers, think stomach flu. Diarrhea. Now, both can cause watery diarrhea, but if it's bloody or if you're having serious cramping, that leans bacterial food poisoning. Fever. Low-grade fevers around 100 degrees Fahrenheit are common with the stomach flu, but higher fevers over 102 are often seen with bacterial infections. Now let's talk about age. Kids and adults experience these illnesses a bit differently. Young children tend to get dehydrated much faster. They tend to vomit more, run higher fevers, and their symptoms can last longer. Adults usually recover faster too, but if you're pregnant, elderly, or immunocompromised, even mild symptoms can become dangerous. So always take it seriously. Now, here's where I see people wait too long before coming in. If you're vomiting for more than 24 hours or 12 hours for a child, you need to be seen. Watch for dehydration, things like dry mouth, no tears when crying, dizziness, or dark urine. Other red flags include high fevers above 102 degrees Fahrenheit, blood in your stool or vomit, severe stomach pain, or symptoms lasting longer than 3 days. If you're in any one of those risk categories, pregnant, immunocompromised, or a caregiver, don't wait. Get checked. Now, let's bust a few myths. These come up in my clinic all the time. Myth number 1, you can sweat out food poisoning. People seem to think that sweating eliminates toxins, but unfortunately, that's not how your body gets rid of infections. Worse, sweating too much can actually lead to dangerous dehydration, especially when you're already losing fluids because you're sick. Don't try to sweat it out. Instead, sip fluids, rest, and let your body recover the right way. Myth number 2, Pepto-Bismol cures food poisoning, and it's safe for kids. Pepto can help reduce symptoms like nausea and diarrhea, but it doesn't cure the infection. And in kids under 12, there's no evidence that it's safe. There's a serious risk of what's called Ray's syndrome, a rare condition linked to aspirin-type drugs, which Pepto-Bismol is one. If your child is sick, talk to a doctor before giving any medication. Myth number 3, you can tell the cause by the color of vomit or diarrhea. This is simply not true, okay? Green, yellow, or foamy vomit, it's probably just bile. And please don't show your doctor pictures that you took on your iPhone, okay? It's the same with diarrhea, especially if you see red or black, color isn't a reliable clue. What matters most is symptom pattern and timing. All right, let's wrap this up. Here's the bottom line. If symptoms hit you fast and hard, think food poisoning. But if they sneak in slowly and spread through the household, think stomach flu. Either way, hydration is always key. Rest, watch your symptoms, and don't hesitate to get care if things aren't improving. You don't have to guess when it comes to your health. That's why I make this series. As a doctor working in urgent care, my job is to figure out what's really going on with you. Now, you've got some of that insight too. Thanks for watching Urgent Care Uncovered. If you want more real-life medical breakdowns like this, make sure you're subscribed. And as always, stay informed, stay dynamic. I'll see you in the next episode of Urgent Care Uncovered.